Welcome to Fight Cancer Global's informational video series. Our aim is to empower individuals with knowledge and resources to combat cancer. Today's video will explore leukemia, offering valuable insights and actionable steps to aid you and your family in the fight against cancer. Leukemia is a type of cancer that originates in the body's blood-forming tissues, including the bone marrow and the lymphatic system. It's a complex group of diseases, characterized by the overproduction of abnormal white blood cells. In effect, these abnormal cells fail to function as they should and gradually crowd out the healthy blood cells in the bone marrow. This condition doesn't just affect one demographic group but can occur in both children and adults. However, it's important to note that some types of leukemia are more common in certain age groups. For instance, acute lymphoblastic leukemia is more common in children, whereas chronic lymphocytic leukemia mostly affects adults over the age of 55. There are four main types of leukemia: acute lymphoblastic leukemia, ALL, acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLL, and chronic myeloid leukemia, CML. Each of these forms of leukemia is defined by the speed of progression and the type of cells affected. Acute leukemia refers to a rapidly progressing disease that results in the buildup of immature blood cells, whereas chronic leukemia progresses more slowly and allows more mature, useful cells to be made. Acute lymphoblastic leukemia, ALL, is the most common type of leukemia in young children. This disease also affects adults, especially those aged 65 and older. Standard treatments include chemotherapy and radiation therapy. Acute myeloid leukemia, AML, occurs in both adults and children. This type of leukemia affects the myeloid line of cells and progresses quickly if not treated. Treatment often involves chemotherapy. Chronic lymphocytic leukemia, CLL, is a slow-growing form of leukemia that affects lymphoid cells. It's most common in adults over the age of 55 and is rarely seen in children. While treatment may not be needed immediately upon diagnosis, when it is, it often involves chemotherapy and targeted drug therapy. Chronic myeloid leukemia, CML, is a type of cancer that affects the blood-forming cells of the bone marrow and grows slowly at first. It tends to affect adults and is treated with targeted therapies that can keep the disease in check for many years. The symptoms of leukemia can vary widely, depending on the type of leukemia and the individual patient. Common symptoms include fatigue, frequent infections, fever, unexplained weight loss, easy bleeding or bruising, and swollen lymph nodes. The risk factors for leukemia include previous cancer treatment, genetic disorders like Down syndrome, exposure to certain chemicals like benzene, smoking, and a family history of leukemia. While some risk factors cannot be controlled, others, such as smoking and chemical exposure, can be reduced. Lastly, it's important to know that while leukemia is a serious disease, many people diagnosed with this condition can have a good quality of life and even be cured, especially if diagnosed early. Medical advancements, especially in targeted therapies and immunotherapies, are improving the outlook for patients with leukemia. In conclusion, leukemia is a complex group of diseases, with different types affecting various demographic groups. It's a condition that arises from the overproduction of abnormal white blood cells, with four main types: ALL, AML, CLL, and CML. The symptoms vary, as do the risk factors, but advances in medical science give hope for better outcomes and higher survival rates. Thank you for viewing this informational video brought to you by Fight Cancer Global. For additional content and support, you can visit our website at www.fightcancerglobal.org, where you will discover a great many resources as well as a supportive community that knows your cancer journey. Let us join forces and make a meaningful impact in the fight against cancer.